Hello there, Dr. Louis Blevins here from Pituitary World News. We're at the 2025 Endocrine Society Meeting held in San Francisco, California. And it's my pleasure to introduce Francesca Galbiati, who has just finished her training at the Brigham and Women's Hospital in Boston and will be joining us at UCSF on the pituitary program team. Francesca, tell us about your research.
Sure, thank you so much for the opportunity. Very excited to share my research with you. So this is a trial and a study that came out of the Massachusetts General Hospital, where, as I split my time between the Brigham and the Mass General, and we're very interested in oxytocin as a therapeutic. So it is a posterior pituitary hormone, and so we're interested in that because we see patients with pituitary disease, but we then look at endpoints by giving it exogenous intranasal oxytocin. Here, we leveraged our clinical trial on intranasal oxytocin for obesity to really understand what happens to sex steroids and prolactin in patients, in participants receiving oxytocin, because there is increasing interest in giving oxytocin to different populations, and we really want to make sure we identify any other potential therapeutic targets or any potential side effects. Here we focused on reproductive endpoints to gather preliminary data on reproductive safety. So oxytocin is a hormone that is involved in reproduction. It's known to increase estradiol, testosterone, and prolactin in mice and some human models. But there's no data on prolonged oxytocin administration in humans on this axis. So this is the design of the trial. We enrolled 61 adults with a BMI greater or equal to 30. We randomized them in a double-blinded fashion to either intranasal oxytocin 4 times a day or placebo for 8 weeks. We measure prolactin, testosterone, and estradiol at baseline, and then again sex steroids at week 4 and 8, and prolactin at week 6. We also measure menstrual cycle length on treatment. We only measure estradiol in women and testosterone in men. These are the baseline characteristics of our participants. There was no difference in any of those between the placebo versus oxytocin group, except that males in the oxytocin group were younger than males in the placebo group, and we accounted for that in our statistical model. So we looked over time in the oxytocin versus placebo group, and we saw no changes in estradiol levels at any time point, no changes in prolactin or in total or free testosterone levels, which was very reassuring. We also look at on-treatment menstrual cycle length in 25 women who had at least 2 menstrual cycles during drug administration, and there was no difference between placebo or oxytocin group. And so we concluded that there's no changes in prolactin or steroid levels after intranasal oxytocin treatment in humans, possibly due to either cross-species differences in oxytocin functioning or resistance to oxytocin of this axis in obesity. Oxytocin reassuringly had no effects on menstrual cycle length. So this allowed us to gather preliminary data on reproductive safety of intranasal oxytocin treatment that are, however, limited just to adults with obesity for now. Thank you. Any questions?
Yeah, I have a couple of questions. So obviously you wouldn't do a study like this unless there was potential to use oxytocin to control weight. So tell us a little bit about what you know regarding that arena.
Yes, so actually the trial to give oxytocin to patients with obesity was exactly because in mice and human models, oxytocin decreases food intake, and then from a caloric perspective and weight loss. There is just one trial in humans that showed actual weight loss. In our trial, that primary endpoint of weight loss was negative, so we didn't observe that. We did observe, though, at week 6 a decrease in caloric intake. So one of the potential explanations is that we didn't give oxytocin for long enough to actually see that decrease in caloric intake reflected into the weight loss. And Concurrently, we also saw improvement in mental health related quality of life that could be kind of a double hit for treatment in obesity, because if we improve metabolism and we improve mental health, that could work together to help obesity health, general health.
Most of our patients who follow us at Pituitary World News are wondering what your thoughts would be regarding the potential benefits to improve bonding and other emotional things in those who have hypopituitarism and diabetes insipidus. Tell us what you know and what future studies you think might be interesting to conduct to learn more.
Absolutely. So there are not too many, but quite a bit of studies on in humans on intranasal, on oxytocin levels, endogenous oxytocin levels in humans with different pituitary disease, from craniopharyngiomas to pituitary adenomas to other hypothalamic damage. And we know that those patients, compared to healthy controls or to their counterparts with anterior pituitary deficiency only, so when there is vasopressin deficiency present, they have lower oxytocin levels and worse social emotional functioning score. They score worse at computerized task of emotion recognition, for example, test. We do have a trial at the Mass General Hospital that just got IRB approval to recruit patients with vasopressin deficiency, where we're going to study both psychological and inflammatory and bone marker endpoints for after administration of exogenous oxytocin, again with the assumption that those patients have lower oxytocin levels, so in oxytocin deficiency.
Fascinating. Thank you for sharing with us today.
Thank you. Thank you so much.